Good morning, ladies and gentlemen. Welcome to our session, Is an Apple a Day Still Enough, or is it no longer enough? And we are trying to, over the next hour and a half, have a discussion with you about the developments in healthcare, the opportunities and the challenges. Before we start with the panel, I would like to take a few minutes to show you some statistics around healthcare. Are we really getting healthier? Are we getting older? Or are we just getting sicker? And as I said, is an apple a day still enough? So a few charts. The first is, are we really getting healthier? And if healthier can be measured with age, then yes, we are getting healthier. As you can see here on the left, average age over the last roughly 50 years has increased from 53 to almost 70 now. And this is a life expectancy, obviously, that has significantly increased, not just in developed countries, but also in developing countries. In this time frame, the average life expectancy has increased from 53 to today 63 years. Also, the percentage, the population of people over 65, we hear it often, is now at 12% and is expected to increase to 15% by 2020, coming from less than 10% just 15 years ago. The pharma industry has contributed, I believe, significantly, and of course I'm a representative of the pharma industry working for Bayer, so you expected me to say this. But if you look at the left graph, and I don't know if it's completely clear, but in the last roughly 20 years, the growth of the pharmaceutical industry has been annually, on average, 9%. And you can see that the total pharmaceutical industry is at the moment roughly $800 billion a year. In that time frame, the pharmaceutical industry has had significant output of new, really meaningful innovative drugs, and an average of around 30 a year, as you can see in the right graph. So the pharmaceutical industry has contributed to this higher life expectancy, I would say, as you can see from these statistics. Now, at the same time, yes, we're getting older, but it seems like we're getting sicker as well. That's what everybody says. And here are just some statistics around this. These are NCDs, these are non-communicable diseases. And non-communicable basically means non-infectious diseases. So these are diseases like cancer, like heart disease, diabetes. And there has been a tremendous increase, an annual increase of 2% a year over the last years, while the world population only grew by 1%. Okay, so what's the reason here? Well, first of all, of course, we are getting older, but secondly, it seems that our lifestyle is leading to more non-communicable disease. And part of the reason is meat consumption. And I'm just showing here on the right that the meat consumption in the world has increased significantly, as you can see here, from 1963 to 2003, basically tripled, particularly, as you can see, in developing countries. So what's happening? We're eating more meat. Our lifestyles also in developing countries become more, quote-unquote, westernized, and we're getting more non-communicable diseases in comparison to the world's population growth. Now the question is this real? Are we really getting sicker? Or are we just better finding out whether or not we are sick? Right? Because, for instance, diabetes is a disease. Many more people suffer from diabetes than we have diagnosed. And the improved diagnostics, to some extent, are responsible, and I'm just giving you as a data point, as our perceived awareness of our sickness. Here's an example. If I can go to the next page. See, yeah. Where we have some statistics of the growth of various imaging diagnostics, like MRI imaging and tomography imaging. And you can see here that the number of diagnostic tests that are being done have grown significantly. And why am I showing this? Just to illustrate that we're also more aware of our sicknesses than we were ever before. So where are we? We're getting older, but it seems like we're getting unhealthier. And this is a very unusual paradox. I just want to show here one slide of Bayer and our new product pipeline. The pharmaceutical industry is still working extremely hard, trying to come up with innovative new drugs to attack some of these diseases, these lifestyle diseases in particular. And I just want to show you one example here at the top of a product that we recently got approval for from the FDA. It's called Xarelto. It is a product that prevents stroke, and as a result of that prevents the debilitating consequences that a stroke patient would have, and basically the stroke patient and the family be held captured to the consequences of stroke, often leading to paralysis. As I said, we're introducing this product. This product is very effective, more effective than the products that are currently on the market, but it came at a tremendous cost. The cost of developing this product was 2 billion euro just in R&D cost for this one particular product. Okay, so 2 billion euro to develop a new pharmaceutical product, and we started this 13 years ago. Okay, so the time and the cost to get to a product approval is tremendous, and it's increasing significantly. Now, there is a tremendous need for new treatments, better treatments, because as you can see here from this list, the challenges for unmet medical needs will continue. And actually, in spite of the advances of medical care, the big killers will also still be the big killers 20, 30 years from now. That is the current expectations. And then particularly lifestyle diseases like heart disease, cardiovascular disease, to some extent cancer and diabetes. Lastly is my last comment, the cost of innovation for the pharmaceutical industry. I plotted here the graph you saw before. About 30 new major drugs come out every year that are based on truly new technology. But the cost of doing so has increased significantly in the last 15 to 20 years. And you can see here, if you take 1996 as a 100% point, the cost of global R&D in pharma has multiplied by 2.5. Okay, so it's currently at around $60 billion a year. What does that mean? It's 2.5 times more expensive to develop a drug today as it was only 15 years ago. And this has to do with the number of things, in particular, approvals are harder to get. Organizations like the FDA are constantly tougher in ultimately approving drugs. That's one part. And the second part is that in drug discovery, the low-hanging fruit, the easy stuff, has been done. In particularly these lifestyle diseases, it is harder and harder to innovate and find really new, meaningful drug methodologies that leads to more and more intense research, and the price, as a result, the cost is going up. What do I worry about with this graph? And this is my last comment. I worry about the affordability of innovation in healthcare. Because you all know there is tremendous pressure on prices for healthcare, on drugs, but also in other areas of healthcare. So the cost is a major concern, understandably. Innovation is getting more expensive, and the question is, can we as a society still afford to do this expensive research, and are we willing to pay the costs that are related to development of major new medical technologies? So I just wanted to set the stage with a few statistics. Yes, we're getting healthier if you measure healthier in life expectancy. But at the same time, changed habits make us somewhat less healthy. Better diagnostics give us the perception that we are less healthy, or at least we're figuring it out at an earlier point in time. And that leads to a perceived sickness for which the medical industry is trying as hard as they can to come up with new innovative solutions that are getting more and more costly every year. So with that perspective, I would like to invite my panel members up to the stage, and we're interested in the discussion with you. Thank you. Thank you.
That's a wonderful presentation, Mr. Dekkers. I think healthcare is an extraordinary topic, simply because it affects all of us in almost the same way. And of all the various issues that concern us as a global community, very few of them affect every part of the planet with the same level of intensity that healthcare does. So I'm extremely delighted that I have the honor to moderate this discussion. When I look at a topic, I realize that as a metaphor, it can be interpreted in a whole range of ways. But in my mind, the most important way to look at it, an apple a day is no longer enough, is to perceive healthcare in the full complexity and flourish with which, as a multidisciplinary field, we must now look at it. And that complexity is unbelievably, in my view, intensifying. So even with the few introductions that will be done by the various panelists that I have, you're going to see contradictions, you're going to see convergences, and I hope that you will leave this particular session enriched about the sheer complexity of the opportunities and the challenges ahead of us. Take NCDs, which Mr. Dekkers mentioned, non-communicable diseases. I come from a part of the world where anytime you mention healthcare, the first thing that comes to mind is infectious diseases. So the malaria, the tuberculosis, the HIV, and the rest of it. The truth, though, is that the developing world already bears 80% of the global health burden as far as non-communicable diseases are concerned. And by 2030, non-communicable diseases in the developing world will outstrip infectious diseases as far as the local health burden is concerned. But then, when you look at this distinction, you immediately become surprised by the fact that, in fact, there is no clear distinction between non-communicable disease and infectious diseases in certain perspectives. And a good example is the fact that in many parts of Uganda, research suggests that diabetics are 3 times more likely also to be infected by tuberculosis. And that of all the people who report to Uganda's only cancer institute, we find out that HIV patients are 3 times more likely to also be cancer patients. So these complexities mean that the simple narrative that will become used to in global health are dissolving. And I hope that after we've had a broad survey of some of the most important trends, we will come to the view that this complexity requires a bit more than some of the superficial conflicts that are often created in this most important part of global affairs. So I'll introduce my panel. Mr. Toby Cosgrave, who is the Chief Executive Officer of Cleveland Clinic, widely regarded as one of the 4 most prestigious healthcare facility, multi-specialty healthcare facility in the United States. Mr. Martin Dekkers, who we've already met, Chairman of the Board of Bayer, which is a very reputable pharmaceutical company. Mr. Stephen Kennedy Smith, who sits on the board of a wide range of very innovative companies like Owl Biomedical, etc. And Mr. Nakagawa, a good friend of mine from the Technology Pioneer days, who about a decade ago founded one of the companies that have set the pace for mobile healthcare research around the world. I'm really honored and I feel extremely delighted that this is the panel that will be discussing global healthcare today. So I will start by asking Mr. Nakagawa to give us his presentation.
Thank you. It's an honor and a privilege to be back here today. Last year, when I was here, I tipped in and became a type 2 diabetic again. And I'm happy to report that as of last week, I completely tipped out and I'm off all diabetic medications. So it's a hard journey. It's really quite difficult. The problem, I don't want to cause arguments among the panel, but one of the biggest problems I found is that medical devices and medicines have really not led to better health outcomes for diabetes. You know, after all, testing is not managing. If I prick my finger this morning after breakfast and take a glucose reading and find that it's high, well, why is it high? If I take my blood pressure and find that it's 198/102, you know, really high, why is it high? Well, I don't know. My doctors don't know, cardiologists don't know, and I'm really quite tired of hearing people say, I don't know, I don't know. Well, wouldn't you like to know? And that was our starting point. We know the statistics on diabetes in the GCC is, you know, overwhelming. It's a huge, huge problem that is getting worse. And just on a personal note, I want to tell you about a good friend of mine in Tokyo. He's a lawyer, Ivy League lawyer from the States, MBA, highly educated, moneyed, positioned. He became a type 2 diabetic 5 years ago, and he'd laughed and said, oh, Jamie, I can manage. I don't need any system, you know. I can do this, I can do that. Well, last month, he's almost blind, and he's going on dialysis. He's not managing. So what's the solution? We created LifeWatcher, integrating 7 different horizontals. And one of the key areas that we focused on is, I'm showing you here, is nutrition. And coming from technology, we believe garbage in, well, garbage out. You know, you are what you eat. Pictures don't lie. So we said, hey, wouldn't it be cool then if we could just take a picture with a cell phone like this or any clamshell phone of everything I'm eating and drinking, say like this, click, send, and within 15 seconds of titling or partial titling, our system will automatically extract the kilocalories, carb, and salt values. And they'll collate that against all your other daily vitals, sports and exercise, medical compliance, and so forth. Excuse me. Well, what's different this year? We saw an explosion of healthcare apps. But the apps in the App Store or Android all tend to be single vertical, single silo, meaning they don't really take a holistic view or do everything quite well. We've seen changing attitudes to healthy diets, the emergence of integrated systems. I mean, what the Healthcare Authority of Abu Dhabi is doing is just phenomenal with the Ruqyah program. We see Medicare slowly catching on in the US like this. Well, what does it mean? It means new opportunities for improved clinical outcomes. And that's a key word we're going to hear a lot is impact studies, clinical trials, raising health outcomes. And as a result of that, we have huge opportunities in lifestyle data mining. What else is different this year is we went back to R&D and we started to develop serious cognition games for the prevention and delaying of early dementia and Alzheimer's. Now, some of you might be saying, oh, come on, how can a game help? Well, this is based on the science and modeling of brain games like Sudoku and so forth. And doctors have long hypothesized that patients with poor glucose control for many years are developing or have developed early dementia and Alzheimer's at higher paces. So it was quite shocking. And I think in the coming years, you're going to see more and more serious games for medical education. Well, what's the lessons learned? Actually, my wife this morning had me revise, so I'm not going to go through this. I think one of the key lessons learned from the GCF and the sessions over the last few days has to do with entrepreneurship is really about sacrifice. It's about passion, it's about drive, commitment, and I think one of the keys is that we have in this room, with all the distinguished guests and stakeholders, we have the ability to go home today, have dinner with our friends and family, and to say, when they ask you, what did you do? If you can answer, I raised the quality of life, I extended life, and I saved my friend's life, I think it's a good day. And on that note, we really implore and would look forward to collaborating and working with you. Thank you.
You have to really point it, yeah.
So this first slide is a slide of two Rembrandt self-portraits, one at the age of 24, the other at the age of 52. And what this slide is meant to dramatize is that people are aging more slowly now. And if you look at Rembrandt in that picture, he's younger than most of the people on this stage, but he doesn't look so good. So 80 is the new, and this squares with your presentation, 80 is the new 50. It's not working. Stand up. Okay. So this second slide dramatizes what our keynote speaker mentioned earlier, that people are living longer. And so at 1900, your life expectancy was 50. The second column is if you made it to the retirement age of 65, what your life expectancy was. So you can see, for our generation, if you make it to the age of 65, your life expectation on average is 83. Now, for our children, the average life expectancy will be 89, and if they make it to retirement age, they're likely to live to 102. This demonstrates the problem. This shows problems with cognition and memory as people age. And you can see that as people get older, there are increasing cognitive and memory problems. And that makes sense because just like every other organ in the body, the brain ages. And as the brain ages, plaque starts to build up. By the time you're 80, there's a 1 in 4 chance of having Alzheimer's, and 1 out of 4 people who are 80 experience memory problems. So when we have a generation of people who are going to live longer, one of the big public health issues is going to be maintaining people's cognitive capacities and quality of life as they age. And this slide demonstrates something that most people don't realize, that actually brain-related illness, and that includes Alzheimer's, schizophrenia, manic depression, Parkinson's, MS, autism, is the largest cause of lost days to illness of any set of illnesses in the world, even more so than cardiovascular disease and cancer. And that is because the brain is the most poorly understood organ in the body, and that's why we really can't treat people with these diseases. And so this is going to be, as people age, an increasing burden on the health system and an increasing challenge that we're going to have to face. I'd like to switch gears now, and the thing I wanted to say about that is why our family, the Kennedy family, has launched a major new initiative in the United States. It's called One Mind for Research, and we have brought together the White House, the major U.S. agencies that deal with health, the health agency, the Defense Department, heads of the major pharma companies, and all the top researchers in the world. And the goal of this initiative is, in the next 10 years, to understand and cure the illnesses of the brain. And we now have the tools in neuroscience and in emerging science that we really can start to address this. And that's a very exciting development for global health. We would welcome the participation of the Saudi government in that initiative. I wanted to switch gears for a moment, and just since the subject of this is entrepreneurship, and talk about what I think are some of the entrepreneurial opportunities in your region, and in particular Saudi Arabia with respect to healthcare. Saudi Arabia is a growing market in terms of, as people are getting older and more prosperous, there's an increasing burden of disease, and there's an increasing population growth. In fact, diabetes in the Gulf region is the highest. Qatar, I think, has the highest diabetes rate in the world of around 30%. And some of that is genetic, and some of that has to do with lifestyle. But that's a real challenge to address. Secondly, there's a growing need for new pharmaceutical drugs and devices here. More than 80% of the medical devices and drugs are imported into this region right now, and that presents a very big opportunity to get economies of manufacturing distribution by bringing some of that to the region. And if I were an entrepreneur here, that is something that I would look at. As I know people are looking at hospitals and clinics and other service-oriented healthcare, but that's, I think, an opportunity that could be explored. Third, the major pharmaceutical companies are not as focused on this market as they are on the European and American and Asian markets, which they view as larger and more profitable. So in terms of being able to acquire, and smaller companies that are developing innovative medical products are not really capable of navigating the complex set of regulations and different national requirements to get their device or their drug into the market. So there's an opportunity to acquire rights to emerging new medical innovations and bring them here, I think, for local businessmen and entrepreneurs. And I'll just give you one example. We were talking about diabetes. There's a company that has just got approval from the FDA, a diabetes patch. It costs about $1. You put it on your skin. It has a micro needle. When you eat your meal, you just push the patch. It dispenses your dose. You don't even feel it. And you throw away the patch at the end of the day. so that's, and there are many other new kinds of similar innovations coming out with respect to cancer and drugs and other things. So I think there's an opportunity there. The last thing I wanted to say is kind of a personal note, which is that it's very actually inspiring for an American to come here and see a society that wants to learn and innovate and make change. And that is very much something that our family has believed in and identifies with. And I really think of my uncles as social entrepreneurs. They were people who saw problems as opportunities. And the example that I want to give you of that is the space program. The Russians put the first cosmonaut into space, and that was perceived as a potential security challenge for the United States. So President Kennedy said, we're going to put a man on the moon by the end of this decade, and we did. And what he said was, he said, we do these things not because they are easy, but because they are hard. Because this goal will measure the best of our energies and skills, because this challenge is one we choose to accept, refuse to postpone, and one we will win. And I see the same spirit here. I see a sense of possibility and the young people who are talented and international with a foot in both worlds. And it's very, very exciting. So I think you'll have great success, and we wish you luck, inshallah.
Well, thank you very much. It's a pleasure to be back into the kingdom. And I'd like to talk to you a little bit about my career and the change. I'm a recovering heart surgeon. And as I moved from heart surgery, I realized that heart surgery and disease management was not the key for us going forward in improving the quality and the length of people's lives. In fact, it was, we had seen the lives of people go up, as you've seen before, in the United States and in Saudi Arabia significantly. But as we look at the future and how we're going to prevent disease as opposed to curing disease, we realize that there are several things that cause premature morbidity and mortality in the United States and around the rest of the world. 40% of the premature deaths in the United States are caused by behavior. That is obesity, sedentary lifestyle, and smoking. And we began to try to prevent these diseases. If we don't, for example, just obesity in the United States now accounts for 10% of the healthcare costs in the United States, and it's projected in the next 10 years to go to 20% of the healthcare costs in the United States. If we don't curb this epidemic, both here and in the United States, there's no way that we're going to prolong lives and to decrease the cost of healthcare across the United States. So we started out in a very small way at our institution by initially began ban smoking on all of our facilities, both in the parking garages and throughout the entire campus of our organization. We then led the way in our particular community by setting an example of being a healthcare organization and not a disease organization. And we decided to stop hiring smokers. And we test them coming in. If they test positive, we offer them smoking cessation, and then we'll let them reapply for a position. We've seen, we've gone out into the community and we've offered smoking cessation across all of Cuyahoga County. And what we've seen is the smoking rate across Cuyahoga County went from one of the highest in the country at 28% to 15% over a 5-year period of time. So you can see that you can actively change the burden of disease and the disease-causing behaviors by one organization beginning to exemplify what healthy care is. Then we began to look at the burden of disease across our organization. And we said, we need to do something for our employees that make them fit, because they are the most valuable commodity in our organization. Of the 40,000 employees of the Cleveland Clinic, there is 60% of the cost of health care that we provide is to salaries and benefit for those 40,000. So we said, let's give them exercise. So we gave them free curves, free Weight Watchers, free yoga classes, and access to our physical facilities. And we put together an entire program of weight management. Over time, you can see some 8 different things, including taking Coke out of the sugar out of the vending machines. And now we have lost 250,000 pounds across our organization in the last year and a half. Now, a journey of 1,000 miles starts with a single step. We have now got about 8 million more pounds to go, but we are at least headed in the right direction. So I think that if we're going to begin to manage the cost of health care, the longevity of our populations, we must begin to decrease the burden of disease. And we need to attack the things that are causing cardiovascular disease and cancer, the 2 #1 killers in the United States and around the world, and in terms of chronic disease. And those are by increasing physical activity, decreasing obesity, and decreasing smoking. It is a pleasure to be back in the kingdom. The Cleveland Clinic has, in fact, been an active participant in the care of people from the kingdom, starting by operating on King Khalid some more than 40 years ago. We continue to be actively involved here. In fact, on Saturday, we've opened an office to help with education and facilitating care in this community. There is some literature on the way out about the Cleveland Clinic and our activities here in the kingdom. Thank you for the opportunity to participate once again in this great symposium.
Thank you very much, Dr. Cosgrave. And the more I listen to the various presentations, the more the various strands appear to intertwine around a couple of issues. One is that healthcare is highly institutionalized. So we have, facilities like yours, and even though you're making extraordinary progress trying to move into the community as well as divert attention from the more institutionalized care of yesteryear, the fact of the matter is that it's still very professionalized. I also get the impression that personal health care is going to be important. People have to take more responsibility for their health care, but these people are obviously not professionals. Then there are the entrepreneurial dimensions of it. Entrepreneurs are going to be very important as they come up with new ideas and with new solutions. The challenge, obviously, is that in a highly regulated industry, in a highly institutionalized industry, entrepreneurs often don't have the latitude and the scope to come up with these solutions, either because regulation makes it more expensive and more difficult, or established professional disciplines are not as open to new ideas from outside those disciplines as perhaps they should be. How we somehow bring all these different strands together and leave our audience with some insights is going to be very important. So I'm going to start with you, Dr. Cosgrave. It seems quite straightforward that people would, undertake some of these life changes that you mentioned, try and exercise more, reduce the sedentary lifestyle by counterbalancing that with exercise, perhaps eat better, so fruits and vegetables and the rest of it. What are the barriers that are preventing us from scaling these good ideas? Because they seem quite obvious.
I think the main thing that we need to understand is that this is a matter of education primarily. Many people do not understand the importance of these activities, and there's little incentive to take care of yourself. And I think increasingly we have to realize that the individual has an important part to play in their health care and their long-term survival and their long-term mental and physical health. Until there's some responsibility on the individual aspect, I don't think that we're going to be able to change this very much. Similarly, I think that there has to be increasing coordination and responsibility in government and in all industries to begin to understand the importance of everything that people bring to the ecosystem, which begins to affect each one of us individually.
Thank you. So the way that I look at it, even though education is going to be quite important, it does appear as if the incentive structures, as you mentioned, does not encourage this educational effort to deepen. Is that more or less something that you believe a government, which has legitimacy, should lead, or should we leave it to the profession?
Yeah, I've been a little disappointed, frankly, in government's willingness to step forward in some of these aspects. For example, smoking. Perfectly possible for government to begin to tax cigarettes out of existence. Their unwillingness to do this because of the political ramifications of that particular thing. That the government needs to step to the fore in some of this too, as well as the responsibility of parents and schools and government to educate on what healthcare, how healthy lifestyle can influence.
James, if people were more interested in their own personal health care, your devices and your products will have a much bigger market because people will actively seek them out. But it appears that is a function of education. The more we educate people, the more they are more likely to seek out solutions like what you have. As an entrepreneur, this is a public good that you can't provide. You don't have the resources.
That's right.
Okay?
That's right. I agree completely. You know, it's the marketing, the communication message at the government level. You know, as an example, I'm on the cloud computing committee at the World Economic Forum, and a lot of countries still don't have, say, a chief technology officer for the government. And I thought in healthcare, why don't they have a chief medical officer or a chief lifestyle officer, or as my title says, a chief care architect who understands these new technologies and he can help push the agenda, which is primarily marketing and communicating and packaging the message. And I think there's a huge disconnect on the way that's been communicated. And it's frustrated us just in dealing with nutritionists who talk somewhat down to you, saying, I know your lifestyle and you should eat half an onion, half a carrot, or 2 units for breakfast. You know, what's 2 units? Most of you, I mean, don't know. It's 80 kilocalories. It's 160 total. But this is how they teach it, and this is how they communicate it.
Well, you know, one of the interesting things that we did is we made a C-level officer, a chief wellness officer, across our entire organization with a responsibility for the employees and for the patients to begin to spread this doctrine, if you will, of taking care of yourself, avoiding the problems. And I think your point's well taken, that if you look at the cost just for a company, and Bayer, I'm sure, has the same thing. You have a huge cost for the health care for your employees. Ours is $300 million, for example. And we begin by these wellness initiatives, we begin to decrease the cost of our health care for our employees.
But, you know, you are an entrepreneur. Most of the people in this room are from the more established part of healthcare. Of course, that's not meant in any way to be derogatory, but that is the fact of the matter, is that you want nimble change, you want the ability to navigate. Do you think that, you know, apart from government, you face resistance from the establishment? So the professional establishment that Dr. Cosgrove represents, the pharmaceutical industry, which is a very well-established industry. Do you face resistance? Do you think they are not open enough to change? Do you feel that somehow they should make more room for people like yourself?
Oh, most definitely. Well, I think, you know, with Dr. Cosgrove, he's been a key supporter and, you know, quite a bit of a mentor to us. The Cleveland Clinic's a little different, but I would say yes, you know, in terms of partnerships with large organizations, it seems at the C level, there's a high level of awareness of these issues, that innovation needs to take place. But the question is, they always introduce us down to the mid-level operating divisional level, and risk-taking is not rewarded. So we spend 6 months, 3 years going through countless meetings and coffee meetings and meetings to set up meetings with no decisions and nothing done.
What do you want them to do? You want doctors to prescribe your solutions?
Well, no,
to patients?
actually, we want, I think the solution is to have more C-level strategic collaboration where most C-level, they just delegate down, but they should be accountable and follow up to really drive and
But what is
incubate
the
this
end game?
innovation.
What is the end game? If the Cleveland Clinic or others like it was to be much more open, if Bayer was to be much more open, what are the exact outcomes that you're looking for as an entrepreneur to thrive in this space?
Simple, a contract. And we've been very fortunate in the last 6 months. We have a big pharma, we have a huge sports nutrition brand, and but to get to this road or this kind of overnight success took 8 years of hard work. It's not a get-rich-quick scheme. And coming from financial IT and Wall Street, the sales cycles are incredibly long, as we all know, and you just have to ride it out.
Having been in this game for a decade as an entrepreneur, trying to, I don't want to use arbitrage, but you're looking for various opportunities and you are navigating these opportunities in healthcare,
Yes.
a very professionalized, institutionalized area. What are the 3 top things you've learned that other aspiring entrepreneurs in this room should bear in mind if they decide that healthcare is where they want to make their living?
Well, I would say, that's a good question. I would say perhaps the most important is to surround yourself with people who are not just passionate but have different skill sets. I mean, it sounds like an MBA program, or a case study, but it's so true. And in our case, we've been rather fortunate. We have great COOs who come from finance and healthcare. We have doctors. And more recently, we even have a GCF speaker, Jean-Michel Helfand, who's the immediate past president of Pfizer Emerging Markets, as an investor and strategic advisor. So he's been helping us navigate as well as make sales calls with big pharmas. And to surround yourself with this type of intelligence and support where you have to realize you don't know everything. And I think the trouble I see with a lot of young entrepreneurs is they either look at themselves or their education or their family or how much money, or they know everything, and they kind of close their mind and start looking down on people rather than looking up and saying, oh boy, I don't know all that, I'm ignorant. Then they should become like an information junkie and remain curious.
And of course, your background is in finance, not medicine. So obviously, there's a wide range of skills in this room that can be brought to bear on healthcare, on the innovation side, on the side of improving outcomes and productivity, et cetera, et cetera. But Mr. Smith, the Kennedy family obviously understand that it's a very multi-stakeholder environment. Healthcare is multidisciplinary. As we're hearing from Ms. Nakagawa, not one set of insights will dominate. That is why you're trying to bring together so many different stakeholders together. Do you think that helps entrepreneurs?
So I'd like to hear questions from the audience at some point. I think that would be interesting because I think I'm always interested in learning about what people are interested in rather than talking myself. But I think there are a couple of problems in the United States. One, the FDA. If they regulate too much, they get criticized for killing innovation, and the cost of developing a drug now is almost prohibitive and a barrier to any kind of an entrepreneur. Two, if they don't regulate enough, then the media jumps on them if one person has a side effect. So I think we have to learn as a society that there are risks associated with new drugs, that we need to tolerate those because the overall benefit is better. So even if we lose some patients, if we're making things better, then we have to accept that. I think that's a barrier we haven't gotten over. Secondly, public education, Michelle Obama is doing it. Third, we've moved away from a big hospital system to a community-based clinic system, and that was a big initiative of my uncle because he felt that people needed to have services in their community. The majority of medical services are day-to-day needs and education, and that's why I think here they should consider developing a more distributed model for healthcare. So those are some of the things that I think would help. And as I said, I think it would be very interesting to have some questions from the audience.
Absolutely, and we'll do that in about a minute.
Okay.
Mr. Dekkers, pharmaceuticals. From the part of the world that I live, global health is seen more or less in terms of medicines. And some of the challenges that is often raised is what are some of the innovative financing mechanisms, which you mentioned yourself, that how are we going to finance all this innovation and the rising cost? Obviously, in some parts of the world, the issue is even more dire because people can't pay directly. In that sense, do you feel that there are opportunities for entrepreneurs in your wider supply chain to improve health outcomes in those parts of the world that may not be able to afford the latest medicines?
Yeah, I think it's a very important point, and Mr. Smith mentioned it as well. The cost of innovation is going up, yet there are tremendously exciting opportunities for further innovation. And the question is, how can we as a global society afford to continue that stream of innovation? Because really, with the price of current drugs, we pay for the innovation in future drugs. And I think a big part of the answer there lies into looking at the integrated cost of healthcare, because we have a tendency in healthcare to be extremely siloed, right? So hospitals, hospital costs, surgeon, pharmaceuticals, drugs, drug cost, elderly care as a silo, and really we should look horizontally at the total cost-benefit picture rather than in these separate silos. And if we, for instance, in our case with Bayer, with our new drug, can prevent stroke, you cannot just calculate the benefit of that in terms of the price of that current drug compared to all the drugs, but you should look at the total cost of stroke for a patient, including maybe 10% in 10 years in a care facility and the cost of that, and be able to prevent it. So a horizontal look at cost benefits is very important, and we're doing a lousy job at that in general in the healthcare world, and we really need to work together to get a much better horizontal cost benefit picture.
Okay. So now Mr. Smith gets his wish, and we open it up to the audience. Questions, as usual, to be helpful, because we have just about 10 minutes left to be on the point. And if you also want to direct your question, please, to a specific person on the panel, please do so.
Thank you. There are some school of thoughts which accuse pharmaceutical companies, big pharmaceutical companies like yours, of fighting fierce war against firms and companies which are promoting alternative medicine, because simply they will reduce your rate of profit. The evidence which they present is that people are dying while medicine is available, but they cannot afford paying it. Based on this accusation, how do you position corporate social responsibility in your business model? Thank you.
I presume this question is to Mr. Derkes of Bayer.
I think it was directed to me, yes.
I think so.
You know, it's a very challenging topic. Why do I say that? Because, of course, when a drug has been developed, we believe that everybody should have access to the drug. And the pharmaceutical industry is not getting a lot of credit for it, but is actually working very hard on access of patients globally, also in poor countries, to have access to meaningful drugs. The issue is often that the medical infrastructure in those countries is not set up to optimally benefit from drugs because distance to hospitals and lack of diagnostic capability. So I am completely with you that the pharmaceutical industry has a responsibility there for current drugs to make them available to as many patients as possible. Where I struggle is it's one thing to have availability of current drugs. It's a completely other topic to be able to afford the innovation for future drugs. So if I give you an example, if we develop a drug now that extends life expectancy of cancer patients, and as a result of that, 40% of people now with a certain cancer survive for 5 years. That's the new drug. We immediately would like to start working on another drug that makes sure that 60% instead of 40% survives more than 5 years. But how do we pay for that with the price we get for the current drug that saves 40% of the lives? And if those prices keep going down, at some point, the ability to afford the innovation for the next drug is no longer there. And therefore, I believe the solution is to look more horizontally at the total cost picture of healthcare so that we don't, in an isolated way, as I said before, look at the individual silo cost.
He had a follow-up question, and I didn't know if you are in a position to answer it, but he felt that the pharmaceutical industry is putting up barriers in the way of alternative medicine. Is that something that you've encountered in your own career, that is the case at all?
No, I mean, I think that the pharmaceutical industry is trying to come up with innovative drugs that really meet unmet medical needs. I think it's very good that society is making it harder to get approval for Me Too drugs, because I think the pharmaceutical industry has spent too much money on Me Too drugs, and therefore too little of its R&D budget on real innovation in the last 10, 20 years. So I promote that heavily, but to say, you know, the pharmaceutical industry is trying to block other alternative methodologies, I don't think that's a fair accusation.
Is there something you would like to, because you also come from, you know, the clinical background, is it the case that the pharmaceutical industry, and perhaps with the implied connivance of the established medical community, is trying to block the growth of homeopathic and alternative medicines?
No, we look at the alternative drugs, alternative methods of care as part of the continuum of our therapy.
More questions, please.
Thank you. Good morning, and thank you everyone for very valuable information. My question is for Mr. Kennedy Smith. If you can shed the light more about the initiative that you are looking to establish, especially here in Saudi, because you extended an invitation to Saudi Arabia to participate to what you're doing. So if you can shed more light about what you're doing, please.
Sure. I think the new model for curing disease is going to be a collaborative model. And so what we have right now are silos where the different government agencies in the United States all make independent grants. We have different individual researchers who are all doing their independent research with small groups of patients. We have pharma companies that are all competing with each other to cure the same disease. And we've got to start to share across those silos. One of the most interesting developments in medicine is a company called 23andMe, which was founded by the girlfriend of Sergey Brin, who founded Google. What 23andMe is doing is aggregating patient data. You give them a saliva sample, and for $100, they analyze your genetics and your future healthcare issues. And then they provide a forum where people can share information about their particular healthcare issue. What this enables us to do for the first time is get data on thousands and millions of patients, and we can use the cloud for research. Instead of doing 100 patient studies, if people are willing to participate, we can do a 1,000,000-person study. So that's a real, a really exciting development in medicine. So we're trying to bring that approach to the U.S. And we feel that the brain is the last frontier of medicine. So every country who wants to participate and learn and be part of this research collaboration, we would welcome. And certainly Saudi Arabia is a leader in health, with your 30% of your budget being devoted to education and health. That's incredible. And with regard to alternative medicine, I want to say that I spoke with a group that has made a grant to KAUST, and KAUST has found bacteria in the Red Sea that have never been found at great depths, and they think it has great medical promise. And I met with a company in India 2 days ago called Parimal Pharmaceuticals. They are mining the Indian continent for bacteria which they believe they can turn into beneficial compounds. So the distinction between alternative and pharmaceutical is breaking down. and people are understanding that natural substances can be just as valuable. And I don't think any of the drug companies are against that. So I hope that's helpful.
And I think another distinction that is also increasingly becoming tenuous is the one between generic and innovator medicines. And not because of the particular compounds, but because within the industry, I'm seeing more and more innovator companies buying into generic companies and vice versa. So that is also another tight distinction that, in my view, is gradually breaking down. James, when you do your solutions, when you put together your solutions, are you overly motivated by orthodox approaches to medicine, or do you ever have to consider whether there's an alternative medicine paradigm that has to fit into these solutions that you are developing?
I think that we have to be open to everything.
Okay.
Because it never worked. I mean, I wouldn't be here today with such a distinguished panel. You know, I would never have the opportunity to have the CEO of a big pharma or, you know, world-famous cardiologist if there were solutions, if people were managing diabetes, if they were not developing, if children were not developing diabetes complications at a younger age, taking medications for it means there isn't a solution. And so you have to be open to alternative, mainstream, all types.
Any more questions? Perfect.
Hello. Yes. Greeting. I'll just shoot out because we are already late. I'm a researcher. I'm an economic student, and I got through my studies to get interested in the healthcare system, and I started to search it and get curious about it, and made my own vision that everybody would have healthcare, proper healthcare for at any time they need it, a hospital healthcare. Whatever he came from, whatever his income, he's insured or not, whenever he needed healthcare at a hospital, he should have it. So I start my search around the world through this idea, and I didn't find a healthcare that support this vision. So I am willing to study this, to study healthcare around the world, and to provide the healthcare necessary model for that can be implemented internationally. So my question is simple, that I am starting my journey for the next 10 years by studying masters in healthcare. So my question is for everyone here in the panel, should I start by studying MBA, concentrating on hospital management, because there might be the problem there in hospital management and healthcare through hospitals and clinics, or masters in public healthcare, MPC, because the problem starts with the public healthcare system and the economy. Thank you.
I think the way, if I understand the question, is that she thinks that the socioeconomic factors are very important, and in her wish to make an impact in the area, she's considering whether to initially specialize in business and economics before moving on, or to start with a master's in public health or something of that sort. I wonder if you have an insight you can share.
You know, it's interesting. If you look at the major advances that have taken place in life expectancy across the world, they have been mostly around public health. For example, at the end of World War II, the life expectancy in China was around 29 years. The life expectancy now is equivalent to what you see in the West and approaching 70. And the first step in that was to drain the swamps and to eliminate starvation. And so these steps in public health have been major propellers, have propelled life expectancy enormously. So there's clearly a lot to be said for that. Now, just a slight tangent of what your question is there the exactly right healthcare delivery system someplace in the world? And I'd say unequivocally no. Europe is now moving increasingly to privatize healthcare. The United States is going just the opposite direction. All of us are trying to balance the cost and the efficiency and the accessibility of healthcare, which is a major challenge as the capabilities of providing healthcare continue to increase. And this is going to be an ever-increasing public health problem and a political discussion that we cannot avoid any place in the world. And it will continue to be a source of requiring innovation as we try to continually improve.
So we are over our time, but if there's one last question, if somebody has a very pressing question, I'll take it. Yes.
Hi, my name is Mohammed Kadham. I'm the general manager of Wordle Spine Center in the UAE. My question is around the competitiveness of healthcare provision. One of the challenges we face in the GCC, maybe not so much in Saudi, is actually adopting best practices. And I think my question would be towards Dr. Cosgrove, and how to actually manage this, including managing health policymakers to understand that we are facing challenges in improving healthcare. So you have definitely cost implications. So your insurance companies are not willing to work with you. And on the other hand, you have health policymakers creating efficient payer systems like DRGs, which are also reducing the compensation for healthcare provision. So here you are trying to improve services, which come at a higher cost, and you're being attacked from all sides. So you need to remain competitiveness, or you need to maintain your competitiveness in this environment. What are your thoughts on that? And I'm sure Cleveland Clinic went through a similar journey, so I'd like to hear that.
Okay, Toby, and you can also wrap up after the question.
That's a great question. And this is something that we're dealing with, again, across all sectors of the world. And I think that the main thing that we have to look at is getting the incentives right. We currently have perverse incentives across all of healthcare. For example, the payers, the insurance companies, their incentive is to make a profit. The providers, under the current, in most systems, their incentive is to do more to get paid more. And the individual has no incentive to take care of himself, no financial incentive. So what I hope we're headed towards is a system that begins to properly align the incentives for all three, payers, providers, and patients, such that we have optimal care for as many people in the world as possible. That is a difficult task, but I think that is going to be the policy initiative that is going to drive the most appropriate care across all countries.
Okay, so in wrapping up, I wonder if all of you in one sentence can tell us one insight you are living with or something that you've changed your mind about from the beginning of the session to the moment. One sentence.
Can you repeat that? I'm sorry.
So one insight you're living with after this discussion or something you've changed your mind about since the session began. And you have just one sentence to do that. Either an insight you want to share?
How's just one word? Optimism.
Optimism, great.
I think I learned from these two gentlemen that it's a systemic issue and that we need to take a holistic approach to regulation, care, and treatment of patients.
I think that I leave with a level of frustration that we are not doing a better job influencing people's lifestyles. And for the life of me, I cannot figure out why people are choosing to have an unhealthy lifestyle, even if it's so clear to them that it's detrimental for their health and ultimately lead to premature death. And how can we get it into people's brains that they should live healthier? I don't know, but it is something we should not give up on.
Yeah, I would say that I think we live in the most exciting time that there is in healthcare. We are in the process of having new technologies. We're in the process of having new understanding of the causes of disease. We're dealing with new diseases, and we're dealing with new delivery systems. all of which makes a time for innovation across the healthcare delivery system greater than it's ever been.
And my insight is that there is perhaps some opportunity in social entrepreneurial as well as entrepreneurial opportunity in breaking down the silos. Thank you very, very much.